Like when she was a baby?
Mahavir Hospital.
So that was 20 years ago in Mahavir Jain in Bangalore?
No, Hyderabad.
This is a Mahavir Jain in Hyderabad also? Okay. Okay, and then?
There only have
two procedures you did first. And now?
And second one was
the palate.
Palate was
11 months. Can you open your mouth for me? Say ha. Okay, that's good. And then the next thing, did you do any bone grafting? No bone grafting. Then directly the nose. The nose was done now in 2018. Where was this done? You have any reports? Did they take any rib?
no rib, they kept this implant.
Oh, they kept a med pore. But you don't have any report, discharge summary? Okay. So, any idea where it was done, when it was done, anything?
In Rhinoplasty Hospital.
But you don't have anything with you, the details about what they had put? Is it silicone? Is it med pore?
Silicone, cardiac.
I don't know, just... Okay, look up. Right. So it looks to me like it's... it feels like a silicone or a peak. It doesn't feel like med pore or biopore.
Silicone.
It's mostly like that. Now, if you're interested, we can improve your nose. But what we'll have to do, because they have put the artificial material inside, we need to remove that, and it's better to use rib, so we get a nice shape and work here, work on the tip, increase the projection, correct that, and if you want, I can also improve the lip. The scar I can't remove fully, can improve a little bit, but the shape, the notching, thickness, 3 important things we can do for your lips. So we can make our lips thicker, because you see the lower lip is little thick, upper one is thin. So when you look from the side, it doesn't look very nice. So we're going to make the upper lip a little bit more plumpier, thicker. The second thing is the shape. There's a little bit of a notching there. See, it's 95% correct. It's not like we're going to do a major thing. And after we finish it, you can expect another 3-4% better. Meaning, it may not be 100%. May not be. Sometimes may be. But the improvement will be there in terms of the thickness, shape, and least the scar. So the scar will also come down a little bit. Not a lot. It will come down a little bit. These are 3 aspects for the lip. For the nose, there is a scar here which is also not looking very nice, but it's not visible. I'll improve that. It's too broad. I think that is the one that's not looking as much as anything else to your face. So to reduce the width, increase the projection, and there's some like that graft is seen like a depression. I'll make it all right. But I'll remove that. We'll remove that and then put rib. So we'll take rib from the right side. You'll need to stay for 7 to 10 days. After 5 days, these sutures will be removed. And these pack will be removed after 5 days. Splint after 7, 8, 9 days. So that's it.
Then what about this?
I'll be correcting that.
No, this
Depression. So that's why I asked, did you have a bone grafting?
No.
You said no.
They said after completing all this.
No, but unfortunately, the bone grafting should have been done when you were early, like about 8 years. Now, if I do bone grafting, I can't do the nose and lip. I don't think it's required so much, because even without bone grafting, it looks 90% okay. We'll do your nose, and we'll do your lip, and after that, also your smile, you see, is a little bit bent. When you smile, smile nicely. You smile properly before, huh? It's going down like that. That they can correct it. They can make a straight smile with smile designing. So without putting bone graft, we can correct all this. So really, once the lip thickness increases...
Will it come in the midline?
Which
even
one?
This tip is not even in the midline.
That will come in the midline. I'll make that in the midline. Nose will be in the midline.
If smile designing also is...
No, that I personally don't do it. We have some doctors who are very good at that.
Okay if we do it?
It's okay, yeah. We can hit the midline. Yeah. But that is also a little long drawn procedure. So we can't do like lip, nose, smile designing, everything in one go. That's not possible. Because when I'm doing the lip, also I'm operating inside on the gums, nasal base, everything, not only on top.
And also I'm having a
into the palate.
Yeah.
So the nasal part I'll close. Openings, normally this is the nose, this is the palate. Two openings will be there. When you close from here, it's called a fistula closure. When you close from here, it's part of the rhinoplasty. That I will do. But I won't open the palate and close. Because you're not having a big problem with that, I don't see it getting worsened. But it's not going to improve. That part will remain the same. What is going to improve? 3 things in the lip and the nose in all. This is what we're going to improve now. Not your teeth, we'll do that later if you want a smile designing, and the fistula also only if you want later. If it's not bothering too much, I don't recommend you to do too many surgeries unnecessarily. Because see, your speech is quite good, you're already quite beautiful, don't need to do too many things. That's what I think, unnecessarily. Get the basic things done and finished. Right? So I need a scan whenever you're ready for surgery, because I'll also try to see what exactly they've put in, how is your septum, how is the bone grafting on the upper jaw, I'm going to see all of that. And then once we see all of that, we can schedule a date for you whenever you want that, and we can go ahead with surgery. You want me to show you something?
That bone.
Yeah, that's what. If you have it, that will be really nice if you can.
They just gave this card for us, that's it.
There's nothing here, Baba. What is this?
But they
Product ID.
They only gave this card.
They only give this part. This is, they're saying it's a patient warranty card of Eurosilicon. So it's a type of a silicone only that they've used. It's a company, I think. They've not given the product type, but they've given the company name. So we can, I think it's going to be silicone, even the way it feels everything. Any doubts you have, madam? Any doubts?
Height also, height, thoda.
Illa madam, height, this thickness will increase, thoda. But the height, if you want here, then this area also is down. This height means you do jaw surgery. I don't think it's needed for a, because that's again a major surgery. You can't do the nose. She's asking for this height, sir. This projection. But you know what will happen? Yeah, there is a little concavity. But in order to correct that, I have to move the jaw. At least by, I would take the scan, maybe 7 mm, 8 mm, like that. And when we do that, then I can't do the nose and the lip. So you have to come one more visit. So that will be super. See, when you first came and told our junior doctor, you've said lip and nose, right? That's the main thing for you. Don't have to do too many things. And again, if after we finish this, you want teeth, you do next. Because teeth also we can correct it a little bit. But if you want me to do the jaw, it's a big procedure. It's not 100% needed for you. Because that healing is separate. Everything is going to take time, you know. And why I undergo some... It'll look good with this itself. There's going to be like a lot of improvement. So... You cannot make out that she has a problem. Everything I will do nose. Can you show? There are many you can see. Cleft rhinoplasties. I have written a chapter on this. You don't worry about that. You'll get good results. And this is immediately after surgery. So we've just completed with this revision cleft reconstructive rhinoplasty. So what you're seeing are the immediate results. Yes, we've also done a lip revision, as is obvious. We've made the lip fuller, nose narrower, taller, better tip, and try to correct most of the asymmetry. So reasonably symmetrical now. We're going to show you how she looked before we started. Pain is there?
Little.
How many days today over? Today is the 6th day? Yeah. So you're going to make sure that these crustaceans and crusts are not there, you know. So this is day 7 and we're just taking off the splint. This is a very difficult, challenging revision, cleft, rhinoplasty with a lot of lip work. So all right, total. So this thing which was removed, okay, the silicone, we've improved the nose to a certain extent. We've made it pointier, narrowed it, increased the height, narrowed it, and the lip, increased the thickness and got a perfect shape also. So you can see the comparison between the upper and the lower lip now. Upper lip has come forward and the nose also standing straight. Well, there's still a little bit of a, but if you see from straight, you're not going to make out. It's going to look like a straight nose. But when you look down, there could be a small issue with the asymmetry. All of this, a lot of swelling is there. Okay, because you have thick skin also and because it's revision also.